So I actually have participated in a clinical trial before. I participated in the COVID-19 vaccine trials, and I also work in clinical trials. Well, at that time, COVID-19, we were in a pandemic and people were dying. And so I thought it was a good idea to participate. On top of that, I do have trust in clinical research because I do work in clinical research. So I don't necessarily have a lot of skepticism that a lot of people do. 100%. I mean, the history, I understand why we have those skepticisms, but I do think that rules have been put in place to alleviate a lot of that skepticism, and I really think that Black people should definitely participate in clinical trials if we want medications to work on us the same way that they work on the majority of the population. I have heard of lupus before. I know it's an autoimmune disease, but that's all I know. I am surprised to know that it affects our community. I feel like I might have heard that somewhere, but I feel like when I hear of lupus, it's usually white people talking about it. So that's interesting. I think if we could build a healthcare hub in our community, definitely focusing on preventing chronic diseases like diabetes, heart disease, different types of cardiovascular disease is really important in our community, as well as getting genetic testing before we have children for sickle cell disease, things like that. A lot of African Americans are big carriers of sickle cell disease, and a lot of us don't know that. So I think it's really important to focus on genetic testing before you start having kids. Honestly, I'm thankful to have no major healthcare concerns. I am one of those people that go to the doctor every year, and if something's funny, I go. I don't hide from the doctor, and I'm thankful for that. And I feel like that should be everybody's motto. Don't hide from the doctor. So actually, my mom is a nurse practitioner. So whenever I have something, I ask her, I'm like, ooh, should I really go get seen for this? Is it that serious? And she'll kind of gauge it. But I do think, if you don't have a nurse practitioner at home, asking, I think it's always good to get checked out, especially if you're in pain. My name is Chia, and I am now included.